As promised, our talk with the doc with Dr. Tim McKnight. Good morning, and
Good morning.
you didn't bring anybody with you, but we wanted to talk about some people who assist you and us quite a bit that are not actual doctors, but they do a lot of different things that are close.
They're really close,
Yeah.
and they're really excellent providers. And I think sometimes people don't understand how well trained they are, and that's why I wanted to mention this. You think about a nurse. I learned as a resident physician, as an intern, to listen to nurses in the hospital. Here I am. I just got my medical degree. I'm a doctor now, and everybody's looking at me for all the answers. And I'm taking care of somebody in the ICU, and there's a seasoned ICU nurse that's been there 15 years. That's seen everything.
Yeah.
And who am I to question someone with that kind of experience? I might be able to understand some of the physiology a little bit better just out of medical school, but their experience is so vast and deep that it's wise for young doctors to listen to nurses. And whether they're nurses in the emergency room, in the ICU, or on the medical floor, most of them with a few years of experience are really good. And one of the things I love about nurses is they're spending time with the patient all day long. They're giving them medication in the morning. They're following up on blood pressure. They're talking to the family and the patient, and they're in and out. They're fluffing the pillow and, getting them repositioned. So they're seeing them constantly. And they have this sixth sense when most of the nurses can detect when something is happening, something isn't right. And they'll tell me, I just don't feel good about this patient. They're gray or something is going on. And they're usually right. And even now, I love it when nurses give me that feedback as I listen to them. So nurses who have been in practice develop that sixth sense because they spend so much time with patients. As physicians, in the office we do, but not in the hospital setting. We're in and out, and they're there all day long. So they have this skill set. So imagine you've got a nurse that's been nursing at this level for several years and decides he or she wants to get an advanced degree. And to become a nurse practitioner, you have to have a bachelor's in nursing, and then you have to have a master's degree or a PhD in nursing. So now you go back to school, and you go through a lot of the same medical training that we had as physicians, and then you spend time in clinics, in hospitals, and offices, much like physicians do in their third and fourth year. So you're getting more exposure to areas that maybe you didn't have to think about as a nurse, because now as a nurse practitioner, you're not just doing what the doctor asks you to do. You're making those medical decisions.
Yeah.
So sometimes when they're in a training, they'll be in my office following me, and we'll talk between patients, or they'll be with other providers. And so they come out with, first they come in with great experience in that sixth sense, and then they come out with the clinical skill set to really start thinking about, well, I used to not have to think about what I'm going to do. Now what am I going to do? Blood pressure's high and the sugar's out of control, and they've got chest pain. Most of the time they know because of their clinical experience, but now they're making the decisions. And so they get that training and they come out. And I have to tell you, the nurse practitioners I work with are phenomenal. Several of them have had ICU experience, and those nurses are exceptional because they see people at their worst. They see families at their worst. They see people who are dying. They see people who are being revived and coming back and living through the experience.
And these are all quick decision times.
Yeah, and these are high-stress times. Yeah. So especially those ones who have had the ICU experience, to me, are golden. But some of them are just, they've been a nurse on the medical floor in the emergency room, and they're just as skilled, just as experienced. That's not a requirement to become a nurse practitioner. You can go to nursing school, get your bachelor's, and then go to get a master's in nursing or a PhD and become a nurse practitioner. And they're also very good because the nursing training is excellent. But those that start with clinical experience and then come through, to me, are so valuable. So our hospitals program at our hospital, I am one of the hospitalists. I work 4 days a month as a hospitalist, and then we have 3 other nurse practitioners. One of them has a ton of experience in different settings in hospitals. Well, actually, all 3 of them do. One of them was 7 years on MedFlight, and at MedFlight, you're going to accidents where people are dying. You're flying people, you're picking people up at hospitals where they have an acute stroke or a heart attack. You're making life-saving decisions on that helicopter and en route. And she's excellent. She's got so many stories. And so when there's a crisis in our hospital, she's like the first one there, and she's got so much experience that everybody just like she's got it under control.
Mm-hmm.
I haven't had those experiences. I have to a certain level some, but not like she has. We have another one of our nurse practitioners who has a PhD. So he's had extensive training in this and a lot of clinical experience. And then there's this third one. To me, they're equals. And in some ways, I feel like they do a better job than I do because they've had so much experience in this. I'm a family doctor who has taken care of patients in the hospital over the years. But at our hospital, they're not critically ill usually. And if they become critically ill, we get them out.
Yeah.
But these providers are used to those things. So I have complete trust in them. Now I have to, as a physician, in Ohio, they need a collaborating physician, someone to kind of oversee their work. I don't really do much oversight because they're so advanced, and they'll text me every morning. Okay, we've got these 5 patients in the hospital, and this is what's going on. This is what we're doing. Just a brief, and every now and then I'll ask for some clarification. Sometimes we'll consult with one another, like let's brainstorm. Let's try to figure out what we want to do next. But I'm often calling them, brainstorming with them. So they're excellent. I can't say enough about the nurse practitioners we have taking care of our hospital patients. And again, they have a great compassion, a great ability to communicate with family and patients. In most cases, my experience, that skill set is better than doctors, because as doctors, we're in and out, like I said, and we don't spend that time with patients and family. So
the doctor classically says, "Let me look at the chart."
Yes.
And who kept the chart?
Right. And again, when the nurse is with them all day and they're seeing a change, you need to listen to them. And the nurse practitioners who are rounding, somebody says somebody looks great. I'm colorblind, first of all, but secondly, I don't know what the different shades are, but they can tell. And because they've seen these people crash, they've seen blood pressure drop enough that they know this is what my experience tells me. So any nurse I have great respect for and I listen to. But these nurse practitioners that I work with are phenomenal. Now, we also have nurse practitioners who see patients in the office. And most of our providers at our hospital, our primary care providers, are nurse practitioners. Same quality. I mean, many of those have spent their nursing career in the ICU or on the medical surgical floor. So they come in with great experience. I have complete trust in them. And every now and then they'll come and ask me a clinical question. And usually it's an area where I have developed a skill set, orthopedics or sports medicine or maybe hormone therapy or something nutritionally. But for the most part, they know what they're doing and they don't really need me. And in Ohio, different states have different laws, but in Ohio, nurse practitioners require very little supervision. They can practice on an off-site. I don't have to be with them. The only thing I really do that I have to oversee with them is some on the home health recertifications I sign off on death certificates from their patients. And if they're prescribing controlled substances, they have to make me aware, but they don't need my permission to do that. Yeah. So they're really, really good. I hope people are comfortable seeing our nurse practitioners wherever they are, because they come with a great experience, a great skill set, and they listen.
Literally, it's a nurse who's now a practitioner. So
that's right. And again, I think one of the things that goes along with nursing is listening to patients, seeing patients, and really connecting with patients. And when you come into that skill set, you're just way beyond where, I'm not going to say where physicians are, but you really have an ability to listen and to perceive things that can easily be overlooked.
Yeah.
And it's experience.
Talk to us a little bit about physician's assistants.
Physician's assistants are very similar. They just they do require physician oversight. So they have a bachelor's degree. They have to have a bachelor's degree, and then they have the master's degree. And it's usually it's in medicine. Mm-hmm. It's not medical school, but they take the same kind of courses. They do the same clinical rotations. They spend the same amount of time, and they have to get certified by their certifying boards to say that they have that, they've developed that level of skill. So physician's assistants have to require 2,000 hours of certification to complete their program. That's a lot of time. Mm-hmm. And so I'm not exactly sure how it works, but I know I've got a friend who's an orthopedic physician assistant, and he is so well respected. He's in assisting with the surgeries. He's not doing the surgery, but he's assisting. But he's in the office and he's reading X-rays and he's helping people, and he works. He's been trained in that field, and he's got more training. He's got training in trauma. He's done other things. So if I have an orthopedic question, I'm on the phone with him, and if those patients need a surgical intervention, then he'll discuss it with his collaborating physician, and they'll arrange it. So they also have a lot of training. They're very good. They're usually at some point they have to declare the area of expertise or interest they have, whether it's family practice, urology, OBGYN, surgery, whatever. And they often get trained by the physician they're working with. So every physician has a style, an approach to patients and conditions, and they get to learn from that physician. This is how we do things in our office. And they're a real help to those providers because that office can see more patients, and they have complete trust in these physician assistants because they come with good training.
Well, it sounds like that they're intercessory to the surgeon, and that's very valuable.
Oh yeah, it really is. Surgeons so the run-of-the-mill follow-ups for a hip replacement or knee replacement, it's just the routine things that they would see in the office. The physician's assistants can handle that. They can see those things, and yeah, we know how to do this. It's not really that difficult, but we have to know what to look for, signs of infection, or maybe the surgery didn't go well, and those things can be trained. They learn that in their training, but then they learn the specific approaches that provider, that medical doctor wants them to practice by, and it works out great. So the only time it doesn't work is usually when there's just a personality mismatch, but the skill set is there, and for a physician to be able to train an extended care provider like that, like this is how we do things, it's great. It works really well. So I just hope the listeners will trust, we call them extended care providers, will trust these providers because they're excellent. And I have no problem consulting with either group. I love, and I feel like I've never felt superior to any of these groups. I feel like we're all colleagues.
Yeah.
I've learned from them, and hopefully, they've learned some from me. But we're all taking care of patients. We all have our place, and there's a demand for these extended care.
I was just going to say that speeds up the process too, right? There are more people to help you.
Yeah, and in primary care, there's a real shortage of family practitioners now. It's really getting tough, and there's a number of reasons for that. But these nurse practitioners, they've really filled that void, and it really helped us in primary care and the physician's assistants. So I think those changes in healthcare have been very positive because we've been able to provide care for patients that need those primary care kind of needs, and we're doing a good job with it because of the quality of the people that do it.
Well, thanks for explaining to us what those titles mean and how we should trust them. We trust you, so now we can trust them.
Well, I appreciate it, but I'm just glad that I can associate with such great people at our hospital and other hospitals. I really appreciate them, and I hope that in all extended care providers, chiropractors, acupuncturists, naturopaths, we all have a place, we all have a skill set, and we can all learn from each other. And we're there to take care of patients, and I think we all genuinely want to do that.
Yeah. Well, thanks again, and look forward to next week.
Okay.
Dr. Tim McKnight on our Talk with the Doc this morning.